New report aims to combat social isolation and loneliness among seniors across our state.
Research has shown that isolation can have significant negative impacts on mental and physical health. The effort is spearheaded by the South Carolina Institute of Medicine and Public Health and the State Department on Aging. The report comes after a task force of more than 40 stakeholders from various state agencies studied this issue for months.
Nick Neville is joining us with recommendations being suggested in that report.
Yes, Dondi and Judy. So it mainly has to do with finding more ways to get seniors connected through programs, through the internet and transportation. And they're looking for more state and federal funding to achieve that goal. A new report sounding the alarm about loneliness among South Carolina's seniors.
When we're talking about what makes our state healthy or unhealthy, social isolation and connection need to become part of that conversation.
Widespread isolation can have the same health impact as smoking 15 cigarettes a day, the U.S. Surgeon General said last month. One way stakeholders across the state are hoping to address that is by having organizations add more social connection programming.
We have restrictions, and part of with COVID and our federal government and the programs that we provided, we had flexibilities. And so we realized with those flexibilities, we need to continue those. So what we're looking at is doing that with our state dollars.
Another way the state's task force hopes to keep seniors connected, working to address gaps in high-speed internet and ensuring that they're able to easily access things like telehealth services. Transportation access also a significant barrier for older folks, the report found. They're suggesting a statewide study looking for ways to close that gap.
We need to talk about those folks that are under-resourced in our state. Public transportation is vital.
State Representative Chandra Dillard making this appeal to all South Carolinians that helping people feel less alone goes beyond policy and funding.
Your viewers have felt lonely at times, so magnify that to the 100th power. And let's, have a check-in with our own selves. Do we want to stay in that state, right? Do we want our older adults to stay in that state? And the answer should be no, right?
The report comes at a critical time as the state's senior population is growing. In 2019, they made up about 19% of the state's population. By 2035, though, they're expected to make up a quarter of the state's residents. Reporting in Columbia, Nick Neville, WIS News 10.
All right, Nick, thank you very much. The South Carolina Department on Aging releases an aging plan about every 5 years, with its next one due in 2025. The agency says this report will help identify gaps in its last plan and identify ways to help meet the growing needs of our seniors.